Student Nurse Partner Program came out of the pandemic. There was a major nursing crisis. There also was a lack of clinical education opportunities for new nursing students to come to the various health systems because they were all shut down. There was an emergency order through the state of Oklahoma, and the Board of Nursing approved it that we could change up the way we were doing clinical education.
This allowed the nursing students to be hired as an employee of the hospital and then be an adjunct to patient care for nursing staff. So they were getting clinical opportunity and salary through that.
I heard about this program by going to class. So one day during our lunch session, they brought in some folks from Norman Regional Hospital. They explained the Student Nurse Partner Program to us, and it sounded like exactly what I was looking for.
I heard about this program through OU College of Nursing. They sent out the Student Nurse Partnership, and I was like, oh, that sounds really interesting, through my email, and I signed up.
To be a student nurse partner, you have to be from a school that we have a clinical academic affiliation agreement with. You have to be a senior level nursing student.
They have to interview, and then if they are selected and approved to be part of the Student Nurse Program, they become Norman Regional Healers.
Then you submit to us proof that you have skill documentation and competency at a certain level. Then also you submit to us that you've had BLS training, and then your school submits to us a letter of good standing saying that you're academically sound and ready for that next level. And we hire you into the position, and you do your clinical hours you are required to do to graduate on a specific unit that you have chosen. We allow you to work in a capacity beside the nurse. In return, you work for us as a patient care technician a minimum of 48 hours in the semester.
Around that third semester, I wanted to go find tech work so that I could do, like I said, I wanted to do the work that I would be delegating to others and to also have a better understanding of the overall care of the patient. When you do those tech shifts, you are alone in the room with the patient. You are getting a lot more one-on-one with the patient. You're having to respond to the patient's discomforts, and you're also getting an eye for how to assess the room.
So this brings them to the bedside where they're practicing those basic skills for patient support. And then also gives them an idea of what the workflow is going to look like. How does a team work on this unit? So that helps them kind of understand, okay, this is what my role is, this is what their role is. When I delegate, when I am the nurse to this person, my expectation should be, and their expectation of me should be. In a traditional clinical practice setting for nursing students, they will be assigned one unit each week, and they will rotate units. So what we do in this program is they are consistently placed for 4, 6, 8 weeks rotations on the same unit. That's based on their choice. So that gives them their opportunity to say, this is where I really want to be, this is my fit, this is my aha, or it's not. The other thing we do is to pick 1 or 2 what we call one-outs. So visit another unit that maybe you haven't had enough exposure to see if that's a better fit for you.
When I got to finally get into the ER and I found the unit that I loved, because Norman Regional allowed me to go into all different types of units to figure out what my passion was for in nursing.
Traditionally, clinical practice is just 8 hours. So they're not actually seeing that day from start to finish. Whereas this program, you start when your nurse starts and you stay till your nurse is done for the day.
To come here and actually be able to do the full shift and see like how a nurse's day starts and how a nurse's day ends, I think was my favorite opportunity, because it showed me, oh yeah, I can totally do this. And this actually makes sense to be here for this long, to provide more consistent care to the patients.
We know that the first year out of school is the most stressful on a nurse coming into practice. So anything we can do to build that comfort level for them helps them to solidify and stay for an extended period of time on a unit rather than hopping from one place to another.
I wasn't as confident in my abilities to perform. I didn't think I was really ready to become a nurse. I think I struggled a lot with just skills in general because I never got to apply them And coming here, working in the ER, working in fast-paced units, even as a tech, it really helped me learn so much, not only as a tech, but as a person, or people skills, communication, things I never got to do in a skills lab.
I would absolutely recommend this program. And the reason why I would recommend this program is because I think this program gives you the exposure that you're not getting in those short clinicals. And it's also giving the opportunity to see different sides of the hospital that just following or shadowing a nurse isn't going to give you. And it also helps you just get more oriented to the healthcare setting.